As experts warn of a surge in COVID-19 cases, and Gauteng expected to emerge as the new epicenter of the virus. Behavioral change needs to take place. Currently, Gauteng has the most active cases of COVID-19, and we saw a rise of over 3,000 cases in just one day, bringing our numbers to almost over 42,000 currently. From that number, we know that over 2,000 are currently in hospital. We also have a concern on that instance as well, where more beds are being added to hospitals as well as field hospitals to ensure that when the surge does occur, the health department is ready to deal with it. Currently, we're in Alexandra here in the north of Johannesburg, a densely populated township north of the city, where many are living in close proximity to each other. We came here earlier in the lockdown regulations when we were at level 5 to get a sense, and that's when we saw those long snaking queues outside many stores. We saw the SASA lines being quite long. Now fast forward to level 3 and we're seeing a change. We don't see those long queues. There is still an issue of social distancing not being adhered to. While the rest of areas are picking up with masking, here it is still a concern. Some citing that it is quite difficult to breathe in it, or they cannot talk properly, while others just forget to bring one when they leave the house, or they only use it when they're getting into stores. We need to see these behavioral changes to ensure that we can curb that spread, especially now as more people are expected to be out and about as economic stores open and activity opens up. We know today that it's expected more businesses to open their doors and to ensure and allow people to return to work. But social distancing, hygiene measures and practices need to be put in place. We saw that there's not many sanitizers being used here on the streets or in the area of Alexandra. We also know that many here still don't think that COVID-19 is a reality. That's it for me for now. Back to you in studio.